Tonight, we are joined by Dr. Richard Myers, the President and Science Director for Hudson Alpha Institute for Biotechnology. Thank you so much for being with us this evening.
Thank you, Naja and Dan.
We understand that Hudson Alpha is doing a lot of work to help in the fight against the coronavirus, including a partnership with Huntsville Hospital to create a therapy for the virus. What is the current progress so far?
Well, that project is very exciting because we along with many others, are trying this around the country to develop antibodies that we can then produce on an industrial scale that could be used to inactivate the virus. And our Hudson Alpha and one of our associate companies, iRepertoire, led by Dr. Jen Han, is working on this project. And we just set up, about 2 or 3 weeks ago, set up a project with Huntsville Hospital to collect blood samples from about 15 patients who have come in who've confirmed with coronavirus, SARS-CoV-2, and use those to try to identify antibodies that could be inactivating. It's a great collaboration. It went really quickly to set it up, to get all the approvals and everything done, and we, Huntsville Hospital, sent over the first samples from a patient on last Friday. We're already working on it.
Big campus. What other projects are underway out there?
Well, there are probably a dozen different projects between Hudson Alpha itself, the nonprofit research institute, but also our 45 biotech companies, and a bunch of them are working on various things, including multiple ways of testing for the virus. We also, within the institute, are working in collaboration with a lab in New York City to try to see if we can develop a very rapid test for testing for possible immunity by taking blood and seeing if we can do that on a very high throughput and very high scale. And I think relevant for the conversation about nursing homes and really many other groups is testing for the virus itself. And the reason I think we do need to be careful about allocating the tests is because they're still a little expensive, and the supply chain and the ability to apply these is somewhat limiting. So as Mr. Spiller said, I think we should apply those to where they're needed the most, people who are ill. But there is this notion of doing population screening. What if we could do that same kind of test for the virus 20 to 30 times cheaper than we can currently, maybe even a lot cheaper than that, and do hundreds of thousands of them in a day? And that's a technology problem, as well as how do you collect that many samples to be able to do that. But we're working in several groups on our campus, as well as other places, to actually make that happen. And I think if we do come up with the ability to do the testing that way, where the sample collection could be rapid, possibly almost surely from saliva as opposed to nasal swab, then such a screening approach would be possible. It's not the same as a clinical test where you have the patient there and you know that somebody's sick and you suspect that it's COVID. It's actually screening asymptomatic people who don't even think they've been exposed necessarily, like in the nursing homes or even in larger groups and companies and schools. The problem, there are multiple problems with that, and we don't want to get too complacent about it. Even if we have such a test like that, there is the issue that you could be SARS-CoV-2 free one day, and the next day or 2 days later you could have it. So you probably would have to do the testing multiple times. Even if you miss some of those, it's probably better to have this than to not have it, especially if we can make it fast, cheap, and importantly, accurate.
And so you mentioned the importance of that expanding testing, and hospitals have told us right now that we're in a pretty good spot, but where do we still need to see some improvements?
Well, Mr. Spillers and the folks at the clinics can answer that a little better than I can, but I do know, because we're doing a lot of the clinical testing for various hospitals and clinics here in Huntsville, around the state, and really around the country, in our associate companies. And those tests are very good. They're accurate. They're even pretty fast. You can get the results back, not in 15 minutes, but in the same day. So that's working pretty well. There have been supply chain problems from the very beginning. Those are hiccups that are really sometimes hard to overcome, but we seem to be doing pretty well now. Now, we're doing well so far in Madison County and North Alabama, or at least much of North Alabama, not everywhere, because we've not had huge numbers of cases, so we haven't overwhelmed the medical system. That could really change in a matter of a day or two if we, have an outbreak, and we certainly could if we're not careful about social distancing, masks, and testing for the virus is not the only thing that needs to be done. Symptom checking, tracing, all of those things are important adjuncts to.
You mentioned accuracy a moment ago. How much of a concern is accuracy, and what is the ideal percentage?
So the good thing is that the test for the virus itself, these are based on the virus genetic sequence, and nobody's relying on one little tiny piece of the virus. They're testing multiple places, so you have some redundancy built in there to make sure that you don't get false positives and false negatives. Either one of those can be particularly bad. The false negative rate is probably a little higher than the false positive rate. False positive rate, meaning who gives a positive test when they don't actually have the virus, is very, very low, far lower than 0.1%. I don't actually know the real number, but it's way down there. The false negative rate is you could miss it because you haven't collected the sample properly, for instance. And early in this pandemic, there were places where that was happening. I think the medical personnel have really learned how to do this and do it well, so that it's much, much better now.
And we're also hearing a lot about antibody testing now in different locations here in the Huntsville area that offer that. So who should get antibody testing?
So antibody testing is really to test to see whether you have immunity. There are two problems with that. A lot of the tests that came out early on, and there were many of them, were extremely inaccurate. You can buy them online from companies that we didn't even know existed days before. So that was part of the problem. So they have to be accurate. And what you're really testing for is somebody who had COVID and has recovered from it. They may never have known that they had it. Are they carrying antibodies around protecting them from subsequent infection, for instance? And the answer is almost surely yes, to some extent. We just don't know how much protection you have or how long it will last. So we have to have an accurate test, first of all. And we need to, if we want to really apply this, it'd be great to be able to apply it in a very high throughput way for tens of thousands, hundreds of thousands of people. So that could be one of the answers here. But we still don't know whether how much immunity you are getting if you are carrying antibodies.
Now, we only have about 30 seconds left, but I want to quickly mention vaccines. I've heard we've never actually produced a vaccine for any of the coronaviruses through the years. Are we any closer to getting a vaccine?
So we're not working on that here at all, but following it very closely. And the answer is people are working, many groups are working, really, really good scientists who know a lot about vaccine development, and they're promising results. It's still going to take a while to get this done because you have to do clinical trials to make sure that that it's safe. But I'm convinced we will get vaccines, and hopefully multiple ones, so we have multiple shots on goal.
Terrific. Dr. Richard Myers, thank you very much for your time tonight.
Thank you.